We have a guest, Marit Ulness.
Yeah.
So Marit is, we were talking a little bit earlier, she's a little weird from the standpoint that she loves talking about health insurance. So we just feel extremely grateful to have somebody like her and her family's company, Ulness Health, who's got a long history of over 25 years in the insurance business. I know your dad years ago, just with her knowledge and talking about the everything that kind of goes around Medicare. And I actually did a little bit of research a couple days ago, kind of preparing for this. And, you know, I just kind of, everybody's kind of using Chat GPT and AI and things like that, right? We're always going there for various questions. And, you know, the number one question about retirement that came up, what is the number one question? And it basically came back to, do I have enough, right? Do I have enough? And the health insurance component fits in so much with that retirement question that everybody's thinking. So we just appreciate your time and expertise. And we encourage you, there's going to be a lot of high level stuff kind of talked about. There's a lot of questions around Medicare, supplements, Advantage plans, things like that. Just encourage you to fill out her form afterwards. If there's any follow-up, if you have any questions, reach directly out to Marit and her team. So thank you very much.
Hello, everyone. Thanks for coming to listen to me babble on about Medicare. And thank you to Dave and Avaii for inviting me. It means a lot to invite their clients to trust me and to have me come out and talk. So thank you very much, and we will jump right in. So everything today is going to be about Medicare. What is Medicare, when to enroll, how to enroll, who's eligible. We'll hit on all of that. These 5 bullet points are just things to be aware of, things that you know. So many times we talk to people, they have no idea how much they're paying per month. They have no idea what their deductible maximum out of pocket is. And it's very helpful to know those things. So premium, of course, that is what everyone is looking at all the time. And then for Ulness Health, maximum out of pocket is a big one, because that is your worst case scenario. So, and that is why we buy health insurance. We don't buy health insurance for little bills here and there. We buy health insurance so that we're protected financially if something were to happen. So maximum out of pocket is always really important. Access to doctors, network of doctors, we'll talk quite a bit about that. Prescription drug coverage. The prescription drug, I don't know what it is, but the last few years, everything with prescription drug coverage has just, they're so expensive. You know, it was always so rare to meet someone who's taking expensive medications, and now 50% of the population is taking expensive medications. So that has obviously shifted plans, but so we'll talk a little bit about that. And then extra benefits, so things that aren't covered by Medicare, but people always appreciate having some extra money towards things like dental, vision, hearing aids, things like that. So we'll talk about that. And then down below are our pictures. So there's me. My dad is John. He, as Dave said, started this almost 25 years ago. He just turned 71 this weekend, and I like to tease him because his only hobby is to work. He doesn't get out much. That and watching congressional hearings. So, he's a great guy, super knowledgeable. It's been really fun as an adult working with him. And then we're going to skip over Don for now. Eric is my big brother. He lives in Minnesota. So he mostly does a lot of our back end stuff, our contracting commissions. He went to law school, so he loves that kind of stuff, where Dad and I are not so keen on the details like that. And then Don has been at our office for 2 years. He kind of stepped in. We hired him after my mom retired. So she was always in this business. He's my dad, and due to some health concerns, she needed to retire. So that's our team. Laura answers our phone. You might catch her, but other than that, that's who we have at Ulness House. So very top level here. So who's eligible for Medicare? People who are turning 65 and of course are older than 65. People who are receiving Social Security disability payments once they've been on Social Security for 24 months, those people are automatically enrolled into Medicare. And sometimes with Social Security, they'll do back payment. They'll back pay 12 months or 6 months, and that time frame will count as 24 months. So sometimes it happens rather quickly for people. And then finally, people with certain conditions. So kidney dialysis, when you're going through kidney dialysis or you have ALS, those people will automatically get Medicare. Okay, so quick history lesson on Medicare. President Truman asked Congress in 1947 to come up with something to provide senior citizens with health insurance. It wasn't until 1965 that President Lyndon B. Johnson signed Medicare into law. And so in 1966, what came to be is Medicare Parts A and B, which we now, well, I'll talk about A and B a lot tonight, but we call it now Original Medicare. Fast forward to 2003, George W. Bush signed the Medicare Modernization Act of 2003, and that started the creation of Medicare Advantage plans and prescription drug plans. So Part C plans began in July 1st of 2004, and the prescription drug plans started January 1st of 2006. I forgot to mention, you don't have to go back, but my dad likes to tell the story that his grandma in 1966 showed him her Medicare card. And she was so excited because for $3 a month, she had health insurance. Which is hard to believe, right? Okay, so here is your Medicare card. This is what we call it the red, white, and blue card. It has your name, your member ID number, which used to be Social Security number, but is now a mixture of letters and numbers unique to you. And then your Part A and your Part B start dates. So those are a lot of times the same date, but they can be different if you continue working past 65. And it's, it's run by the government. We call it Centers for Medicare and Medicaid Services, CMS, which is the government, and you enroll through Social Security. So we'll talk more about enrolling on a further slide, but this column here explains or shows you, I guess, what your coverage would be like if you only had original Medicare and you didn't put anything else on top of it. So Part A covers your inpatient hospital care, and that does not have a monthly premium. It is $0 a month, as long as you've worked your 40 quarters and paid into the Medicare system, or you were married to somebody who worked 40 quarters and paid into the Medicare system. So it's pretty rare to find someone who has a premium at all for Part A. Your coverage is, it's going to cover your inpatient care. So they, of course, consider hospital, inpatient hospital, because outpatient emergency room, that's covered under Part B. But inpatient hospital, you would pay the first $1,676 deductible. If you're there for more than 60 days, it does go to a per day copay. It does happen, but rare. Skilled nursing facility is covered under Part A. It's important to note that with skilled nursing facilities, Medicare only covers a stay at a skilled nursing facility, if you're actively participating in rehab, is something you'll eventually go home for. Medicare does not cover anything to do with someone who needs maintenance care, even for a short period of time. You have to be participating in rehab. And then home health care is also thrown in under Part A. So that brings us to Part B. Part B is everything else. So all of your outpatient care, doctor's visits, ambulance, chemo, outpatient surgeries. It's a long list of things. Part B does have a monthly premium. For most people, it's $185 a month. We'll touch on that on the next slide, but most people pay $185. So with your coverage, with Part B, you pay the first $257 deductible. That works just like a traditional deductible like we're used to paying. It runs calendar year, so it resets every January 1. So if you have a November birthday and you're starting November 1st, you get, it resets January 1. So it always runs calendar year. So after the 257 is met, you would pay 20% of all of your bills. So as you can see at the bottom, the reason why you want to have something in addition to just your original Medicare is that there's no maximum out of pocket. If you were to have a catastrophic year, there's nowhere where these bills stop coming to you and the insurance company takes over. You just keep paying. The other reason to have something on top of Medicare is to have prescription drug coverage. That's not included with original Medicare. That's something you would have to actively go pick up on your own. Okay, so this is IRMA. I'll try not to spend too much time on this, but it can be something that is surprising to people. So we always bring it up when we meet with our clients. Part A, as I mentioned, has no monthly premium. Part B is normally $185 for most people. However, this down at the bottom here, so IRMA stands for Income Related Monthly Adjusted Amount. And that applies to Part B and Part D. So if you're an individual, if your income is over $106,000, you're going to pay more for your Part B. And so that's spelled out over here. So it's a $185, you would pay an additional $74 a month, which comes out to $259 a month. And then in addition, any Part D plan you choose gets an extra $13.70 gets added to that premium. So, and then it goes up from there. Or let me back up. So a couple on that same level, if a couple's household size of 2, if their income is over $212,000, same thing. You're paying an extra $74 a month for your Part B, and that goes for both of you. I had a client call me once and he's like, well, this is my income, but my wife doesn't make that income. Well, the government doesn't see it that way. So, and there's 5 tiers. So it goes up from there. And then the one thing to know is that they look back 2 years. So they're not looking at the current year, they're looking back at your income 2 years ago. So a lot of times when you're working, you're making a good income, but when you retire, obviously that income disappears. So there is a form we can fill out to kind of combat the IRMA. It's called a change in circumstance form. So if you find yourself in that situation, it's worth a phone call and at least filling out the form to see if we can escape the extra charge. Okay. All right, how do you enroll in Medicare? So if you're drawing Social Security, you're going to be automatically sent your Medicare card. And it will come to you in the mail about 3.5 months before your birth month. Also, same thing with receiving Social Security disability benefits. Once it hits 24 months, they're going to automatically send you your card. So this example here is, if your birthday is, oh, I get this question a lot. So people will assume that their birthday is later in the month. So they'll think that their Medicare won't start till the month or the day of their birthday. Or to, in this example, push it to September 1st. But your Medicare will always start the first of your birth month when you're turning 65. The only exception to that is if you're born on the first of the month. So if you're born August 1st, in this case, then your Medicare would actually start July 1st. You really can't fight that. It normally works out in favor for people because they're excited to start Medicare most of the time. So that's if you're drawing Social Security. Otherwise, and this is happening more and more because people are retiring and waiting to start drawing Social Security. So they're, turning 65 and not necessarily receiving the Social Security benefits. So those people have to go out and actively apply for their Medicare to begin. You can do that 2 different ways. You can start out at the Medicare.gov website. It will eventually get you to myssa.gov. So if you have a myssa.gov account, you can apply using that portal. Or we highly recommend working with the local Social Security office. When you apply through your portal, your application gets sent to Chicago. And so most of the time it works just fine, but we've run into cases where for whatever reason, Chicago is hanging on to the application and not processing it. And, we're waiting for that magical Medicare beneficiary ID number and we have to call and transfer it to the local Social Security office. So it'll be really your preference of what you want, how you want to apply, but those are the 2 different routes you can go. The local Social Security office does a nice job most of the time. I always say it's like a mini DMV. You go in and you get a number and you wait. You can also make an appointment if you don't want to wait. Okay, so now we're going to switch to your options to put on top of original Medicare. So when you're new to Medicare, you're kind of at a fork in the road. There's lots of different companies to choose, whichever route you decide to go with. But you're either going to choose between a Medicare supplement or a Medicare Advantage plan. Sometimes people ask if they can have both, and you can't. So it's one or the other. So we'll talk about a Medicare supplement first. It is also called a Medigap plan. So you kind of use supplement interchangeably. You have to kind of dig to find out what people really have. But a Medicare supplement is very different from an Advantage plan. In Wisconsin, we do things differently. So it breaks my heart when people come in with the Medicare new book and they've been reading and studying and highlighting and questions, and they get to Plan G and Plan H and they've got all these questions, and I say, I'm so sorry, but Wisconsin doesn't do those. What we have in Wisconsin for Medicare supplements is we have a paid rate, and then we add riders. So whichever riders you guys choose, it can be an a la carte type of deal. But Medicare supplements starts with the basic coverage, and then you choose the riders. So most everyone takes the Part A deductible rider. The supplement company is going to pay that deductible, or if you're there for more than 60 days, that per day copay. They're gonna pick up your portion. The Part B deductible rider, I do still have listed there, but you have to have started Medicare before the year 2020 in order to be eligible for the Part B deductible rider. The government made changes. They said people with a Medicare supplement need to have skin in the game. So they took away the ability to take the Part B deductible rider. So that's where if you take a supplement, you have to pay that first $257 each year. And then Part B excess charge rider, that is one we normally recommend. That's if you run into a doctor who accepts Medicare, but not Medicare assignment. So those doctors can try to charge you an extra 15%. And by taking this rider, you wouldn't ever have to pay anything in addition. And then the home health care rider and foreign travel rider. Some supplements have it all built in already and you don't really notice it, but others, like it'll add $1.50 to your monthly fee if you pick up the foreign travel rider. That is for emergency care only. So something to be aware of. On a side note, if foreign travel is in your future, we do highly recommend picking up a small travel policy. What's great about those is those help pay to get you home if something happens and you can't take a regular flight home. My mom had a client spend $40,000 getting home from Costa Rica. Cool. Because he didn't pick that up. So just a side note. Don't just go by the foreign travel rider for $1. Okay, so we can move on. So this slide is just going to show you how it works. With a Medicare supplement, you go to the doctor, you give them both of your cards. The doctor's office is going to bill original Medicare first. They're going to pay their portion of the bill, and then the supplement company is going to pick up your portion of the bill. So that is, again, we have to pay that Part B deductible, which is currently $257. But then once that's satisfied, you're 100% covered, as long as you're going to someone who accepts Medicare. So if they're portable, Medicare supplements, if you choose a United Medicare supplement and you move to Florida, change your residency, you stay in the exact same Medicare supplement that you chose, but you're going to pay the new rate. So whether it's less than the rate that in Wisconsin or more than the rate in Wisconsin, they have to keep you. You have to stay on. But you do have to pay the rate of the area you live in. Another thing to mention with a supplement is, yes, but came back. So guaranteed issue. There's a lot of talk about guaranteed issues. So when you are new to Medicare, you have a guaranteed issue into a Medicare supplement. Every application is going to have health underwriting questions. It will ask you at first a list of different ailments, and you say yes to any of those. It'll say, don't bother applying. It's going to be an automatic denial. If we can get through those questions, we'll sometimes continue on, get a little bit more detail, ask about doctor visits, hospital stays you may have had. My point being that when you're new to Medicare, you have a guaranteed issue, we don't have to answer any of those questions. But if you've been on a Medicare Advantage plan, which we'll dive into here in a little bit, and it's been more than 6 months, now we have to answer the health underwriting questions. And they can deny you. It's not a matter of, we'll just pay more per month. That's not how it works. It's either you're in or you're out. So just something to know with the Medicare supplement. And also, they do not have a network of doctors. So you nationwide, anyone who accepts Medicare, you can go to and with your Medicare supplement. Okay, so this is just kind of hitting home the prior slide. So this column here is your original Medicare and your portion, what you would have to pay with original Medicare. And then the supplement company, you see all the zero, except for the 257. Part B deductible, not to beat a dead horse here, but it might be kind of hard for you guys to see, but under Medicare supplement up in the corner, it has an estimated cost of $150 a month. So that is obviously just a general price. I find that $150 is now more accurate for female rates. Male rates seem to have gone up. They're more in the $160 range for someone who's just turning 65. But what I want to touch on is that price goes up every year. That's the nature of the beast. So you'll start out paying $150 to $160 a month. But every year that you get older, and they also take into consideration medical inflation, your rate goes up. That's just how it is. So for someone who's 70, they're probably paying $200 a month for their supplement. If you're 83, you might be paying almost $400. Yes.
So you have to pay your Part B of 185 plus the supplement?
Yes, ma'am.
Okay.
You nailed it. Yep. Yeah. There's really no escaping the Part B premium. So anything you do is going to be on top of that.
Per person.
Yes, ma'am. Okay. All right. Prescription drug plan. With the Medicare supplement, it does not include your prescription drug coverage. So we need to talk about a solution for prescription drug coverage. I could talk for a really long time about prescription drug coverages, so I'll keep it short and sweet. The Inflation Reduction Act made a ton of changes for 2025. So we had a chaotic year. This last annual enrollment period, but the biggest thing, and it's good for members, is that it took away the coverage gap. So this here in red, I left it here, but that's gone. So that was also referred to as the donut hole, if you ever had anyone who had to deal with that. But what you see here in this chart is the government standard. So every year they come out with a standardized prescription drug plan, and the private companies have to do at least as good as the standard plan. They can do better. You're going to pay a higher monthly premium, but you can have no deductible instead of $590 deductible. But a company can't have a $600 deductible. They have to do at least as good as the standardized plan. So again, this is very general, but you start out in your deductible phase of possibly $590. Then you switch to initial coverage, which has to be at least where you pay only 25% of the cost of medications. Most of the time you're paying co-pays for things. There are, the Ozempics, the Trulicity, the Eliquis. Sometimes now you're not always, but you could be paying a percentage on medications like that. However, for the first time ever, you are protected by a maximum out-of-pocket for your prescription medications with Medicare. That has never happened before. So, okay, about that. But generally speaking, last year 2024 is a little bit different, but prior to that, you never stopped paying for your prescriptions with Medicare. Even in catastrophic coverage, here where you pay $0, you were paying 5% of the cost of your medication. So it's good for a lot of people. It affected about 3% of the population. But this is what we have as the government meddles every year. Okay, so one last note on that other slide is that late enrollment penalty. So a lot of times people will say, well, I don't take any prescriptions. Or earlier today, my client said, well, I take a torvastatin and it's free, basically. Like they give it away. You have to have creditable coverage. So that is something that we have to always have a conversation about. If you don't take prescription drug coverage when you're first eligible, you start accruing a late enrollment penalty. So it's based on how many months you go without prescription drug coverage. Of course, they have a big, long, fancy formula for it, but it works out to be about 35 cents a month times however many months you go without having credible prescription drug coverage. So we've seen some big ones it can happen, but you only pay it if you eventually do sign up for a prescription drug. So some people just keep not having one, but, okay. All right, so here is Medicare Advantage plans. So this is referring to also known as Part C. I should tell you that because of the nature of this meeting, I cannot talk about any specific plans. So all of these numbers here are really kind of just made up. They're not based off of any plan in particular, but just to kind of give you an idea of what to expect. So the first column here is a Medicare Advantage plan with prescription drug plans. We call it MAPD. And it's a PPO, Preferred Provider Organization. So this plan, a traditional PPO, is you're going to have in-network coverage and out-of-network coverage. So you might pay a little bit more to be able to go out of network, but you're still covered, you're still protected financially, and you have the option to go out of network if you'd like. So for anyone who travels even a little bit, and of course, people who rent a house for a month or 6 months, or maybe you have children who live in a different state. I really recommend getting a PPO. I had a lady tell me, I'm 91 years old, Marit, I barely leave the house. Okay, fine. Okay. I give up. But I highly recommend a PPO. Even not traveling, you get that horrible diagnosis, where your life changes in an instant. I want you to be able to go to the doctors that you want to be able to see, not the doctors that are in your plan. So, but that's my opinion. So you'll see here, with a Medicare Advantage plan, there are plans with premiums, but most of them these days, the companies keep investing in the $0 a month premium plan. So those are not false numbers, the $0 a month that you see here across the board. So you pay $185 a month for your Part B, but you don't pay an additional premium. So the prescription drug coverage is wrapped up into this plan. You pay co-pays for things as you use it, and you're protected by a maximum out of pocket. So that's that first column. The second column is going to be an HMO product. HMOs, you have in-network coverage, and you do not have coverage out of them. You'd be on your own for those bills. So an HMO does have to cover you in the event of an emergency. I have two really good stories about an HMO. I have one client who took an HMO against my advice. But she had a Medicare Advantage HMO. She was in Missouri on a property that her family owned. She was walking down stairs, a regular set of stairs, missed a step, fell, broke her ankle. So her HMO covered the ambulance to come pick her up. It covered the emergency room. They triaged her. They set her ankle. They wrapped her up really good. But her husband had to drive from Hortonville to Missouri, pick her up and drive her back home in order to have surgery done. So that is how an HMO is going to work. They're going to cover you in emergency, but any follow-up care, you're going to have to go back home. My other client had a PPO. She was in Texas. They had rented a house, her and her husband, for a few months, riding a bicycle. She had her little dog in the basket in front. Car pulled up. She went up and over. The car broke both of her arms, wrists. I know. She had the option. She got to decide, do I want to stay in Texas, keep the rental that we've paid for already, and have surgery and rehab done here in Texas, or do I want to go home? She decided to stay in Texas, and she was thrilled with her coverage. She couldn't believe it. So not to go on and on, but that's a kind of the difference between HMO and PPO. Third column is MA only. So that does not include prescription drug coverage. Those are generally going to be aimed at veterans. So people who have access to the VA for their creditable prescription drug coverage. They'll have to get all of their meds through the VA. But this can be a great option for veterans, especially, you know, even the ones who really prefer to use the VA for a lot of their services. But this can give them options if something happens and they can't travel to a VA facility, or, you know, it's a long wait perhaps with the VA. So it's pretty rare someone takes an MA only plan, but it has its place. And then lastly is the Medicare savings account. That is going to be a high deductible plan. You're going to pay every single bill until you've reached a large, again, these are fake numbers, but you know, you're going to pay out thousands of dollars first before the insurance company kicks in. So you pay out, this uses $6,000, which is a little high, but so you pay the first $6,000 and then you're 100% covered after that. The reason why you might take an MSA is that in return, the plan deposits a pretty good chunk of money into a Medicare savings account for you each year. So the idea behind that is that's some money that will build up and will over time shrink your deductible because you'll have access to those funds. Okay, so here is kind of a little comparison of supplements and prescription drug plan versus Medicare Advantage plan. So again, you choose one or the other route. This is pretty small here, but it kind of just runs out the math, right? Because that's what we're always looking at. So with the supplement, when you add up the Part B premium, your Medicare supplement premium, which I think is a little bit low, at $150 a month, plus I use the average prescription drug plan in the United States, that's probably a little bit high. But it came out to over $4,000 that you're going to be paying out whether you need to use the plan or not. Because of course you would have little to no max out-of-pocket costs with that $257. Or you can go with an Advantage plan, which you still have to pay the $185 a month, but you don't pay any additional premium. So that adds up to $2,200 for what your total cost would be. And really for the Medicare Advantage plan, it would take, I mean, I think there were like $5,000 max out of pocket. That would be a horrible year, a catastrophic, horrible year. And generally, even people with quite a few health concerns, they're paying out about $1,000 maybe in a year with their Medicare Advantage as far as just paying co-pays and stuff. One thing to note is that supplements don't offer really any extra benefits. So a Medicare supplement only has premium dollars to pay out. So there are a couple that still offer free gym memberships, but other than that, that's the only extra benefit you're going to get out of the supplement. A Medicare Advantage plan, fortunately, with the changes, the Inflation Reduction Act, it did, you know, it shifted a lot of costs to the plans, and it was a lot of really unknown costs because it's so new and they have to all adjust, but they did, of course, cut extra benefits. They all still have something there to help. Free gym membership is almost always included. Dental is normally there's something there along with vision. Hearing aids is generally a discount program that's included with your Medicare Advantage. And then there's some over-the-counter items that are generally covered as well. So when you sit down with someone who's 65, it's like, well, I'm healthy, but my concerns are dental, vision, and hearing. It's like, well, Medicare doesn't cover any of that. The Advantage plans are very aware of that, and they're sure trying to get you guys the most for your money. Okay, enrollment periods. So IEP stands for initial enrollment period. That is when you are brand new to Medicare. When your Part A and your Part B start dates are the same, that is your IEP. Most often, it's when you turn 65, unless you're working past 65. SEP can be a long list of things, but if you move, or most common one is leaving employer coverage. So you work past 65, your spouse works past 65, and you are leaving employer coverage, that would be considered a special enrollment period. It can be, another special enrollment period can be OEP, so open enrollment period. Open enrollment period is not something that people can advertise. They can't market OEP to you. But if you call and you know, it's January 1st or February, you didn't realize the changes to your plan, and they're unfavorable to you, you don't like it, we do have the option to switch plans during the OEP, which is January 1st to March 31st. And then, of course, my favorite time of year, annual enrollment period. So that's when your TV goes crazy. It's pretty great. It's a lot. I sat with someone at their kitchen table once, and she had left the TV on for the appointment, and I could not believe how many. I mean, it's just relentless. The commercials. One after the other. So AEP is every year, October 15th to December 7th. That's when you can make a change. So you're generally choosing a plan for the year. I always tell people, if there's something that comes up that you don't like or you're interested, call me. There's normally a way we can shimmy to a different plan, even in the middle of the year. But technically, these are the enrollment periods. And we're like done here. So my little tip, this is our office building. So we're at downtown Appleton. I have a few tips here. Never call a 1-800 number, please. Again, the TV commercials that are relentless, where everything's free, and free groceries, and just a litany of $5,000 for dental. Those commercials are aimed at people with Medicare and Medicaid. So those people are eligible for a different set of plans. And what they're doing is they're trying to get you to call, and they say, I'm so sorry, but you're not eligible for that plan, but I have this plan. And it happens a lot. And people hang up, they have no idea what just happened. They don't even know if they've switched or not. And it just creates a bit of a mess. I actually have a client who just fell for it. The OEP, he's not even supposed to be calling. And she was in the hospital. She answered, and it was the last day of OEP, and she switched. And so now she's counting down the days that she can switch back. So never call a 1-800 number. Another thing I want to touch on is Medicare is very much a local program. It's run by the government, but the plans available to you go by the county that you live in. So what's true in Tennessee or Minnesota or even, Texas is not necessarily true here. And I like to throw my husband under the bus, but I tease him that he's been working to retire since he was 18 years old. And so he gets a lot of financial magazines and things of that nature, YouTube videos. And whenever they talk about Medicare, he sends it to me. And a lot of times what they're saying isn't true in our area. And maybe it's true for where that person is who's writing the article or doing the YouTube video, but it's, which brings me to my next bullet point of, it's a great idea to work with an independent agent. I'm obviously very biased, but it's a good idea. Don't just call Humana, don't just call United, because all they have to offer you is the company that they're working for. So with an independent agent, you'll have access to all the plans. to sit down with someone, talk about your personal situation, your wants, your needs out of a plan and, direct you in the right direction. Ulness Health is almost to a fault, not pushy. We have built our business. My dad, I mean, gosh, I was in college and he, he was helping people that he would never get any money for. And I really credit that to how he has built this business. We always do what's right for the person sitting across from us. So that is the end of my presentation. So if there's any other questions, I can answer. Yes, sir.
How many different companies do you represent with these plans?
So we have 8 different companies, and that is every company available in kind of our, these counties, Winnebago, Brown, when people move up north, I feel less comfortable. I really want you guys to meet with someone who's very knowledgeable on the plans that are available to you, but.
Would you say most of your clients are using a pretty good spread of those 8, or would you say there's 2 or 3 or 4 that are really popular?
Yes, I would say that there are some plans that are very popular, yes. Yeah,
I've been on Medicare Advantage for several years.
okay.
If I would want to switch back, what is the penalty to switch back to regular Medicare?
What do you mean by, why would there be a penalty?
When I signed up, they said, if you sign up for Medicare Advantage and you decide you want to go to regular Medicare,
Yeah,
there's a penalty if you don't sign up for it to begin with.
so do you mean original Medicare as in, the Part A deductible of 20%, or do you mean original Medicare as in a Medicare supplement along with original Medicare?
Probably the Medicare plus the supplement.
So there wouldn't be a penalty. Neither case would be a penalty. You can always just go back to original Medicare if you'd like. I wouldn't recommend it, but, yeah, you can change to a Medicare supplement. We would have to answer the health underwriting questions.
Right.
And honestly, they're really not that difficult to pass. But it's definitely worth looking at it if you're considering it.
The other follow-up is, there seems to be a bit in the news saying Medicare Advantage is not the way to go. And I wonder if you have any comments about that.
Yes, so I touched on it a little bit where people from other parts of the United States will kind of poo-poo Medicare Advantage plans. In that case, it's generally HMOs, because an HMO, if you only have HMOs to choose from, that would be a much harder decision than having really competitive PPOs available to you. I had another thought on that. Oh, the other thing is the government doesn't love Medicare Advantage. The way that they offer you a plan for $0 a month is now when you choose a company to be your Medicare Advantage plan provider, now the government is sending your Medicare benefit to that company. They don't get to keep that money. So that's my little 2 cents on why the government doesn't love it, and they're surprised that private companies are really good at managing the benefit, managing the money and getting, being competitive and wanting to have the best product out.
Thank you.
Hopefully that answered.
Following up on her original question, when I signed up for Medicare this year, and I was looking at the Advantage versus the supplement, many different people that I talked to in organizations, we had to have a 5-year clean bill of health if you wanted to go from Advantage back to the supplement plan.
So there are like cancer, have you had cancer in the last 5 years? That's a very common question on a Medicare supplement. And that's true. Sometimes be insulin dependent. That is an automatic denial. Not always, depends on the company. But it can be there's a whole list, you know, COPD, that could be one. You answer yes to that, it's gonna be an automatic denial. Yeah.
I'd say macular degeneration, and they told me that I went one way, I couldn't go back the other way. I'd never be a good real health for 5 years.
Interesting. I don't know that specific ailment. I don't know, no, it doesn't come out to me on in memory from the applications. They're all different. What did you decide?
I don't need to supplement.
You did? Okay. Well, it'd be interesting to kind of just look at the apps and see what the wording is, because it's not always 5 years, I would say.
What's the percentage of supplement versus advantage?
We find that a lot of people take advantage. And that's the
Are
charge.
there a lot of people that switch back and forth?
No. No. Yes.
I know, for example, with my parents, they had a Banker's Life supplement and they were paying $800 a month for their premium, plus their Part D, plus their Part B.
Yeah.
And they didn't see a bill on anything.
No.
It was paid 100%. But the $800 they paid that no matter whether they went to the doctor or not.
Right.
And so we switched them over I switched them over to an Advantage plan. And I explained, if you go to the ER, there's $100 copay. If you go,
Yeah.
there's copays along the way, but if you don't use it, you don't pay anything other than your Part B.
Yeah.
And they end up getting money back on their Social Security because their Advantage plan covered Part D. And I figured it out as the worst case scenario, they saved $10,000 a year. And if they both met their out-of-pocket max, which they weren't anywhere near that. I find that most people have a supplement policy and they have it because it's part of a union contract, that's part of their retirement benefits, and they don't pay the premiums. The premium is part of a contracted benefit. So I don't know, I'm a fan of the Advantage plans, but when I go to the pharmacy, I always ask, what is his prescription if I don't have bill any insurance? Because sometimes you're better off owning no insurance and I don't understand why. And when I became Medicare eligible, I tried to figure out how much my 2 prescriptions were gonna cost me, and they were telling me like $1,400 for 3 months. And I said, well, I'll stop taking them. And I went to Smith Pharmacy in Little Shooter and I paid $40 a packet. So it's always worth asking, and I don't know who's getting the extra money and how I'm getting the offer, but I always ask.
It is definitely always worth asking. You can pay a lot of copays with $800 in a month, for sure. That is something we could talk about. Someone who is on a Medicare supplement and they're in their 80s and they think I'm 80, who would want to insure me at this point? Going to a Medicare Advantage plan is always an option. And also to add, the average lifespan of a Medicare supplement is 7 years. United is very proud of their supplement because their average is 10 years. So people get sick of paying the high premiums, and like I said, they go up every year, which is frustrating. But some people die with the supplement that they chose when they were 65. So everyone's different. During AEP, I'll get a lot of children who are taking care of their parents, and they'll ask, they're paying almost $400 a month a piece, if it's a married couple, and they'll ask me, should we switch? And at that point, that's hard, because switching them to a Medicare Advantage plan, I don't know if that's what you find, but it can be make that child's job more difficult depending on their parents' capabilities at that time. So, always worth asking.
The worst part was canceling your Banker's Life.
Yeah, you need them. It has to be in writing. Yeah. Okay, any other questions? Yes, sir.
What is the motivation of people who are on, let's say, I'm on the Advantage PPO plan.
Yes.
Why would I ever want to go back to the other plan? Is that want to spend more money?
Yeah.
Maybe
And receive less bills.
that's when you read.
You know, I'll get the comment, well, I don't want to get charged when I go to the doctor's office. I want to just pay more and be covered. But again, that's rare. Most people want to keep their money and pay for things as they use it and know that they're protected by a maximum if a catastrophic event were to happen. So one for you, like just as you are paying your bills, you know, pay attention to what the portion is that your supplement is picking up.
And because I have an outpatient from the surgery and for every 6 weeks, it very quickly.
Sure. So that, just to give you an idea, that an outpatient procedure like that would range from like $250 to $400, depending on the Advantage plan that you chose. Yes.
Is it true that an Advantage plan does not cover long-term care versus the supplement that does?
That's gonna be the same. So, because that's Medicare. Medicare only covers long-term care if you're actively participating in rehab for something you'll eventually go home for.
And
These
even
are planned.
hospitalized for 3 days prior to going to the nursing rehab. We learned
What's
that.
that?
hard, right? You have to be hospitalized for 3 days.
That's not true anymore. It used to be.
Oh,
Yeah.
but we got caught in that. That cost us $8,000.
Yeah. It's been a while. It's been a while since,
Well, that's good.
yeah.
Maybe my question should have been on an Advantage plan, if you go into a nursing home, it doesn't cover that.
Yes.
Why are you in the nursing home? Like, are you in a nursing home because you,
No, not for rehab, for the rest of your
no,
life.
Medicare's never gonna cover that, regardless. Regardless of the, expensive supplement or Advantage plan, it's not.
And the
You'll
advantage
be
plan
self-pay.
micromanage you while you're in the rehab facility. And they will tell you on Tuesday, we're done paying on Friday, and it's a huge scramble to try to figure out what you're gonna do. Yeah, they micromanage you very bad.
So that kind of leads into my question about access to care, how quickly you can get care, how much control you retain in terms of housing and care between the two different groups tracks. And then I do have a long-term care policy that's not going to get in the way of anything. That sounds like it'll be necessary to me.
Yes, yeah, I would definitely, if you choose, yeah, keep that separately. As far as, I mean, a Medicare Advantage plan, yeah, I mean, it's managed care. And, that's where the company that you choose can make a difference. Again, we've got great options available, in our area that, I can't mention names, but I had a client who was in the hospital, woke up, or wasn't in the hospital yet, but he woke up and he couldn't walk. And it was just mystery, and he's in the hospital, the doctors are coming in, nurses are coming in, and they're saying, your insurance plan's not gonna cover it. Cause he wanted a intense, in the hospital rehab. And doctors are coming in, nurses are coming in, they're like, insurance won't cover it. They're not gonna cover it. So he called me all fired up. I'm like, okay. So I got as much information as I could. I called the company, and the company's like, we have no record. We have no record of him being in the hospital. We have no inquiry on whether or not the service he's asking for will be covered. Doctors and nurses were just coming in and saying, if your insurance can cover it.
So
So,
if we were to see you privately, you could give us maybe some more. advice.
yes, so that really, is the next step, is to meet one-on-one with somebody and have a personalized conversation. What David's handing out here is a little bit of a worksheet, questions that we ask to gather information, what's important to you, prescription medications you're taking that need to be covered and on the formulary of the plans we look at, as well as doctors. So of course, that prescriptions come into play regardless, because you have to have prescription drug coverage, but doctors you go to a supplement, you don't need to worry about that, but it can make a difference for Medicare Advantage.
What about what Pat is telling?
Sure, yeah, the counties that are close to here, yeah.
How about Portage? Portage County?
Portage County, oh, I would have to look at the list, I don't know.
Right on the edge of Opac.
That's a different kind of part of the state.
Another question to ask is, do some services require a prior authorization with an Advantage plan?
Some do, for in-network, that's normally done behind the scenes, the doctor's office takes care of that for you.